Mr. Onur.
Hello.
For blocked heart vessels, stent, or bypass?
One of the most common questions I encounter in my daily practice. Of course, there cannot be a definite, clear answer to this question for everyone. We are talking about a sensitive process that varies for each patient, directly affects the patient's life, and requires serious experience in the decision-making process. With the advancing stent and drug-coated balloon technologies, modern interventional materials and techniques, long-term follow-up scientific studies show us positive, good results on the stent side. Still, when making a decision, it is beneficial to carefully evaluate the extent of the vascular blockage, the structure of the vessel, the heart's contraction functions, the patient's accompanying additional diseases, and possible valve problems. The final decision should always be individualized for each patient.
I was told there is plaque in my heart vessels. What does this mean?
This situation is a long-term and dynamic process caused by cholesterol accumulation in the vessel wall. We call this arteriosclerosis or atherosclerosis. These plaques can gradually narrow the inner diameter of the vessel and, when reaching a certain level, restrict blood flow to the heart muscle. However, not every plaque is the same. While some plaques can remain silent for years, others have risky features that can suddenly rupture and lead to a heart attack. Therefore, what is important is not just the presence of the plaque, but accurately assessing the structure, extent, and the patient's risk profile. In the solution phase, blood pressure, blood sugar, cholesterol, and weight control, along with a heart protective diet model and intensive exercise program, are of vital importance.
Should every high cholesterol level be treated?
First of all, it should be noted not every high cholesterol level requires treatment because evaluating cholesterol alone is not sufficient.
In today's risk assessment, alongside risk factors such as diabetes, hypertension, smoking, family history, and obesity, parameters like lipoprotein, apolipoprotein B, and high-sensitive CRP should also be considered in appropriate patients along with classic lipid values.
According to all this data, the patient's risk profile and risk score are determined. And based on this risk score, the thresholds for starting treatment and the target values during treatment may vary.
Accordingly, lifestyle changes may be sufficient for some patients, while others may require earlier and more intensive treatment. The goal is not only to lower cholesterol, but also to reduce the development of vascular disease and the risk of heart attack. It is possible to make the most accurate decision based on a detailed evaluation specific to the patient.
Could you provide information about carotid stenting?
A narrowing of the carotid artery, commonly known as the jugular vein, like coronary artery disease, is also an important vascular disease. Narrowing of the carotid artery can be completely silent, or it can reduce blood flow to the brain or cause a stroke by blocking a brain vessel with a piece that breaks off from the plaque. Symptoms such as temporary vision loss, speech disorder, or unilateral weakness, even if short-lived, can be a warning sign of an impending stroke and should definitely be evaluated. During the evaluation, ultrasound, tomography, MRI, and angiography provide us with important information about the plaque structure causing the patient's stenosis. Carotid stenting, which we perform on suitable patients, offers an effective, safe, and comfortable treatment option. During the procedure, thanks to protective filters, the risk of clots reaching the brain is minimized while the narrowed segment is widened with a stent to restore optimal blood flow to the brain. Correct patient selection, appropriate technique, experienced operator, and performing this procedure in experienced centers play a decisive role in success. It should be kept in mind that with early diagnosis and correct intervention, strokes due to carotid stenosis can be significantly reduced.
Who is Associate Professor Dr. Onur Kadir Uysal?
I am originally from Antalya. I am married and a father of 2 children. As of May 2025, I started at private Adana Middle East Hospital. The topics I am interested in are all complex coronary interventions.
I am actively involved with left main bifurcation, IVUS, FFR, CTO, all these procedures. Additionally, I have significant experience in carotid stenting. I also actively perform peripheral artery disease procedures.